Welcome to Behavioral Grooves. My name is Kurt Nelson.
And I'm Tim Houlihan. Given the strange and turbulent times that we are living through, Kurt and I decided to reach out to some of our favorite behavioral science researchers and practitioners to get their take on the novel coronavirus pandemic that is shaking the world.
These special edition episodes will explore a variety of different aspects of the crisis and our response to each of those aspects through a behavioral lens.
We know that you may feel overwhelmed by the crisis already. It seems every news story, every social media thread, every phone conversation that we have is focused on some aspect of the pandemic right now. While the news and updated information are essential, we're going to take a different tact. We want to try to understand the science behind our reactions and our behaviors and how science can help us cope and move beyond the current crisis.
In each episode, we talk with a different behavioral science expert and get their best thinking on an aspect of the crisis. So sit back, take a deep breath, and listen to our special series on behavioral science and the coronavirus pandemic. Before we get to our guest today, we have a special announcement. Tim and I are excited to announce that we just launched a Patreon campaign where you can donate to help us offset some of the hard costs of production of this show, Behavioral Grooves. On average, each hour of the show takes between 8 and 10 hours of our combined work. Now, granted, most of that is Tim, but still. Between the research that we do, the preparation, our interview recording, post-production for both the intros and for our grooving sessions, editing and hosting, it's a lot.
Yeah, and beyond the documents that we create for all this, we also develop episode notes that feature on average a dozen links to behavioral science resources and about a half a dozen musical references.
Yep. We do that. Actually, again, you do that.
Well, for over 2 years, we have been doing this work without any kind of monetary support. And we do incur hosting fees and website design and maintenance fees, transcription costs, and we have to pay for storage for literally the terabytes of data for each one of these episodes.
You know, we love doing this show. This isn't about making a profit for us. It's an effort of passion, but it does require a lot of work we've outlined, as well as those hard costs that Tim mentioned. Your support in this effort and your patronage is really, really appreciated. We have many different pledge levels that you can choose from, starting with one that is less than the cost of a special coffee at Starbucks. So please check this out. And you can go to www.patreon.com/behavioral grooves to find all of those different levels and to pledge any amount that you want for us. And you can find that information in the show notes.
Yeah, and check out the musical tiers, the musical links. You know, they're kind of silly, kind of fun. Okay, today's special episode guest is Cristina Bicchieri, and she is a professor of philosophy and psychology at the University of Pennsylvania, a professor of legal studies at the Wharton School, the head of the Behavioral Ethics Lab, the director of the Philosophy, Politics, and Economics program, and is the faculty director of the Master of Behavioral and Decision Sciences program at the University of Pennsylvania. Now, as if that weren't enough, her research work with UNICEF keeps her busy with projects literally all around the world. Cristina was featured in episode 102, and we were excited when she emailed us this week about some new observations she's made about the crisis. Now, the following is our conversation with Dr. Cristina Bicchieri. Cristina Bicchieri, welcome back to Behavioral Grooves.
Thank you. Happy to be here.
We are so glad to be having you here today to be able to talk about messengers and norms of nudging. And so let's just get started. You mentioned that behaviors are interdependent.
Yeah.
Tell us about that.
Yeah. What does it mean? It means that my preference for behaving one way or another depends on what I see or I believe other people are doing and what I believe other people approve or disapprove of. Of course, other people is not the word, but is people that matter to me, what I call the reference network. And, as I will tell you later on, it's very important when you send a message to choose the right reference network. I give you an example. When you say, most people stay home, okay, is a very ambiguous and generic message. And a young person may start thinking, well, most people are older than me. Yeah. And most people are vulnerable. So they say, well, I'm not like them. And so this information is really not relevant for me. Okay. So for example, when you send information to millennials, you should send information about other millennials in the same place, not even millennials in Mumbai or, I don't know, London. Okay, what matters to people is what other people they can identify with. Okay, what I call the reference network are doing or believing or thinking or whatever. But this is what matters.
How different can people be before the message starts to be diluted?
They
age, gender,
is easily diluted. Is easily diluted. I think age matters a lot. Okay. And all the information we got, especially in Italy, but I think here too, but in Italy, it happened much before. So I was very much in tune with that, was older people are dying. People with previous, with other diseases like diabetes, heart disease, asthma and whatnot are dying, etc. And so they are creating basically categories of people that most people do not identify with. Yeah. And this is a problem because then people start saying, okay, but I am different. I am young, I'm healthy. And what's happened in Italy, you saw on television, lots of young people going around in the street, congregating in groups, etc. Or you saw it here. I was amazed when I saw the Florida spring break vacation, where you say thousands of people going around. And then when they were interviewed, there was this young guy that said, I don't care about COVID-19. I will get it. I will be fine.
Yeah.
So obviously, we have to pay attention to the message we send, and the reference group is important.
So Cristina, given the crisis that we're in today, how do you think our media and leadership have been communicating? Has it been a good job? Have they been doing an okay job, or have they failed miserably on this, or is it a mix of all?
They didn't mean to do a bad job, obviously. Nobody does.
Fair enough.
But they have done a subpar job, I would say. And let me give you, I told him I have 6 important advices about what to do or not to do, and it's more than what not to do. Let's say the first advice is do not send conflicting messages. For example, in the same message, in Italian television, but is the same everywhere, they show that the Italian police is arresting and fining thousands of people that go around without permission, because in Italy you need now to have a sort of self-certification in which you say, I'm going to the pharmacy, I'm going to the hospital, etc. And at the same time, as I was showing, very visually, you see the police stopping people, etc. You send a message, people should stay home. The right thing to do is staying home. So you have an injunctive message, you should do that, but also a descriptive message, which is the opposite. Now, all my research shows that descriptive is a stronger signal than prescriptive. Why so? Because we infer a lot of things from a descriptive message. Let's say we see people going around in Florida. What do we infer? The situation may not be that bad. If people really believe it were bad, wouldn't they stay home? So it's sending us a message that people don't think it is that bad, and maybe they are right. And since we are motivated thinkers, that is, we twist we twist reality at the time. We choose what to believe.
No.
It gives us a justification. We look for justification to indulge our temptation to go out. We see our neighbor walking around. We have all the justification we need. Okay? And so again, is what I call a collective action problem. Is our individual welfare versus the collective welfare. And so sending these inconsistent messages, okay, lead people to misbehave. And especially important is when the empirical is negative, with the descriptive is negative. I show people transgressing. They go out. They do things that they shouldn't do. It normalizes that. So this is the first rule. Don't send conflicting messages, especially when the descriptive is negative, is a transgression. The second is, let's make the desired behavior observable, because people need to see that other people are staying home. Okay? And, it's very, very important. This is really crucial. You have, for example, social media user can send messages, or update advertising their choice to stay home. Instagram, for example, has prioritized a stay home sticker that people can add to their post. Or local municipalities could encourage citizens to label their home with a badge to show that they are proudly staying indoors. So there are lots of things that we can do to increase observability. Observability sends a strong message. No, people are really doing that. Okay, and this is crucial. So
because if we're not going outside, then we're not seeing anyone, and we don't have any reinforcement that it's actually a good thing to do.
Exactly.
Yeah, so this is a way of using social media to actually help support that. That's cool.
Support that. The third thing is give information about what others are doing only when such behaviors are positive.
Okay.
So avoid the example I gave you. There are all these messages that are negative. Okay, people are not doing what they should do, etc., etc. So the third principle is do not normalize transgressions, basically. Give messages only when it is a positive message. Show empty streets, show barren parks, show these things. These give a clear idea people are not outside. So
the media focus in on those beaches in Florida over spring break was exactly the opposite of what they should have been doing in that point in order to change behavior to be positive.
It's tempting for the media to show outliers. Okay. But this warps our belief of how common the good behavior is. So, yes. And the media like always to show the bad things. Look, it's very punitive in some sense, but it's wrong.
But that's what grabs attention. So their model of business is to get more people to watch. And you watch when things are transgression and there's an aspect of breaking the rules or whatever it would be.
Yes. But this is terrible.
When we talked to Deborah Small, and she said the media doesn't really like to report on things that aren't happening. So the idea of reporting on an empty street, empty street is nothing for them to report on.
It's an empty street. What's interesting about that?
But you're saying that that's what we need to see. We need to actually see news reports of empty streets.
Well, to tell you the truth, I was really shocked by looking Piazza del Duomo in Milano, which is my hometown, empty. Empty. There were only the birds, the pigeons. I mean, it's a huge square, and it was empty. It had an effect on me.
Well, there was a picture of a fox going down Michigan Avenue in Chicago, again, because it was so empty.
Yeah,
it's hard to believe that you would have that type of –
Exactly.
Those are the good messages. Okay.
Exactly. So a fourth thing is, as I said before, choose the appropriate reference network. So when you send a message, think whom you're sending the message to. Okay. And you may have to send different messages to different type of people, different ages, etc. And, usually when you choose the right reference network, the people that, let's say, young people can identify with, it's much more powerful, as I said before. 5, avoid moralizing messages. Why? Because when you send moralizing messages and say, the right thing to do is, you're good if you do this or that, the implicit information is people are doing the opposite. That's why we're sending you the message. And that's why we know that moralizing messages in general do not work well. Exactly because people infer something from them. Why do you send me this message? It means that, people are not doing what you want us to do. So it's a big mistake.
Have you seen some of that, Cristina? Have you
Absolutely.
witnessed?
Absolutely. Lots of moralizing messages like saying the right thing to do is you should do that now, etc. And again, people may think, okay, especially also when you see the opposite, there is a moralizing message. As you see the opposite, what do you think? Well, people are not doing that. What do you infer from that? Well, maybe they are right.
I've seen a lot of messages around we should do this for the common good, for the collective welfare.
And it is right. The problem is not so much for whom we should do that. The problem is the should. Okay, we should. It means people are not doing stuff that that improve collective welfare. So the moralizing message is not a good
Excellent.
idea. 6, very important, avoid ambiguity. Now, why? Because when we are faced with ambiguous information, we tend to interpret it in a self-serving way. That's a fact of lies.
It's human, right?
It's human. So there are 2 types of ambiguity. One is the use of general language. And I told you before, when you say most people are staying home, you may think most are older than me, most are sicker than me, most have pre-existing disease. I'm not one of them. So this generic message is reinterpreted as, yes, those people are staying home and they are right to do that, but I don't need to do that at all. But there is another thing, which I took a note about that. When the Center for Disease Control put out the guidance, avoid discretionary travel, social visits, and shopping trips. Now, discretionary travel was one of the most searched terms on Google after they did that. Why? Because people is vague, is ambiguous. I think, should I go to the dentist or not? Should I go to my hairdresser? I need a cut. Should I go? Shouldn't I go? What is discretionary? Okay. So it's very, very important that the message is not ambiguous. Okay. And these are 2 examples of very ambiguous messages.
And even when we think about this, if we don't really think about it, because, discretionary travel seems like it's pretty straightforward, but yet it isn't, because discretionary can have different meanings.
Exactly.
So we have to
That's why people go on Google.
Yeah, you got to Google it, right? What does discretionary mean?
What the hell is it? How do I interpret it?
Would it have been better, or would it still be better for the CDC to actually list trips that are considered acceptable and those that are not acceptable, so that it's more discreet and explicit?
I think so. People need guidance. And again, when you want to give guidance, don't be ambiguous. And, the summary here is send clear, unambiguous, positive, specific messages. This is what you should do.
Okay.
And this is not, going back to your original question, what most governments start doing.
Well, Christina, I did see something too where somebody, they had a post of kind of real ambiguous stuff, and then another one, and one of the thing that they said there was go to the, it wasn't should, it was limit grocery trips to once a week. It's like very specific on those descriptions.
Absolutely.
Okay. So
Absolutely. That's important because I have guidance. They tell me, okay, try to go just once a week. End of story.
I want to go back to, you had talked about the appropriate reference network, and we talked about that at the beginning, but then also as step number 4 in this. Yeah. Does it matter for that reference group who the messenger is?
It does, because you want the message to be credible.
Okay.
You want people to trust the message and the messenger. And so if it is, as I gave you the example of Instagram, etc., they have all their little networks. And if the message comes from these networks, for example, is very powerful. If it comes from the prime minister, is much less powerful, obviously. Okay, so you have, or it must come, for example, from somebody that, let's say, young people love, some public figure, people they can understand, identify with, etc. But their peers are very important. Very, very important.
So social media actually has a big part to play in this, regardless of if you're a big influencer or not, because you are that reference point for those others within that group.
Crucial. And I think more should be done in this respect. Much more should be done.
So, of course, I look at the world through my own lens. It's very difficult to see the world through other people's lenses. But I think about political leaders. Thinking about reference networks and messengers. When a political leader says, makes some comments about the medical state of affairs, it seems to be less credible than when a physician speaks those things. And that's for me. But do I hear you saying that it might actually be more effective, let's say, if I'm in my early 20s and I'm very much into music and entertainment, and to have a movie star or someone who is a popular musical star deliver that message might be more impactful?
Yes, it is. Provided that people identify with this person, that they trust this person, that they love this person. Yes, it is. And it is happening. Okay, it has happened in Italy, it's happening in England, it's happening in Spain, it's happening everywhere. But I also think that it is very important to have a way of communicating among themselves, like the Instagram example, the Facebook example, etc. Communicating among themselves and seeing what their peers are doing. In fact, the media star is important, but sometimes it's even more important to be able to see what your peers are doing.
Would there potentially be any blowback? Again, you're talking about the Instagram sticker that goes on. And so if I am in my son is 14, right? And he's out on Instagram, and even millennials are old for him. So if he sees a bunch of millennials pushing this, sticker out there, I don't want to be like those old people. Is there any backfire effect that could possibly happen because the reference groups that are doing it aren't your reference group?
Well, the problem is, the question is does your son have a reference group? And if he does, certainly they would matter. Okay. They can, it's not just millennials, but it's younger kids that talk to younger kids. Kids very young now have Instagram accounts and Twitter or whatever, they use, that they have their own means of communication. And so they do have reference group, and not necessarily millennials. Yeah. Yes, your son may be completely indifferent to what 25-year-olds do, but he will be very into what his peers do, the kids in his class, his friends of friends, and things like that.
Yeah, that's exactly it. Because and I know this from my own personal experience with him, is when I tell him something, yes, I'm his father and I have a little bit of an authority figure there, but there's also this, you're just old. You're just old.
That's what my daughter tells us.
And I just, you don't understand me. It's, again, I'm not part of that. And so, when I tell him something, there's almost this like, I need to do the opposite now. And I'm wondering, again, that idea of maybe some of those younger generations, again, he does have an Instagram account. He does have his reference group of his friends, but if his friends aren't doing it and other people are they actually going to do the opposite because they see that as old people doing it and we're not old?
Possible, exactly.
Yeah.
It's absolutely possible.
Which lends me into my next question. And Tim, I'm sorry to monopolize here, but you had talked at the beginning a little bit about the individual versus the collective welfare. And I think that comes into it because I think, again, I will reference my son and I hope he listens to this and he can have a conversation with me. But, there's this very focused perspective of him on him. Right. And what's this all impacting, how it's impacting him and why would I need to worry about this? And we're trying to say, well, it's not about you. It's about us and grandma and grandpa. And I don't think he gets it, but he doesn't really get it.
Absolutely. And it's not just him.
I know that.
Because you see a lot of people. I was telling Tim before that, we had a little chat before. When I go to the supermarket, there are lots of people that barely keep a distance, that don't wear a mask, they don't seem to care that much. So it's not just your son. There are lots of people that do not seem to be very convinced. And again, I go back to the problem of communication and the messages that people are receiving. When people are receiving contradictory, conflicting messages, they go with the bad descriptive one. They see other people are doing the things that the media or the politician recommend not to do. They go with that. So I think that if there were a total absence of such conflicting messages, and if you were to send good descriptive messages, maybe accompanied by an injuncting, prescriptive message is fine, but they are to be consistent and to be very positive, not negative. I think that is the big problem.
Cristina, you're doing a lot of work. You've done a lot of work over the years with changing social norms, especially when those social norms were not in the best welfare of either the individuals or the collective. In this case, not only do we have the possibility of people acting on these very unhealthy social norms, but there's a political aspect to our motivated thinking. To what role do you think our political identities, the political tribe that we get associated with, how much do you think that has to do with the alignment behind our willingness to be open to one social norm or to accept the social norm or to not accept the social norm or to identify differently?
So this is a very general question. If we look at it related to COVID-19, to the situation we're in, what I think is we need to create new norms that were not there before. Okay? So before people could behave as much, do as much as they want, behave as freely as they like, etc. And now we are asking people to be less free. We are asking people, to stay home, to wear a mask, to do this, to do that, things they are not accustomed to do. And some people may think it impinges on their freedom. So sometime for people who put a lot of weight on freedom and autonomy, that might feel like a severe restriction and might lead almost to an oppositional behavior. We know that in psychology, it happens. If you are very much giving very much weight to freedom, your autonomy, you can do what you choose to do, nobody's telling you what to do, etc. either these people are super convinced that it is good for their safety more than other people's safety. Is I am safe if I do that. Otherwise, they may take a very oppositional road, oppositional behavior. This is a risk. This is a risk.
Oh, go ahead, Kurt.
Oh, I was just going to say, you talked about creating new norms. And so going back to your grocery store example where you're there and some people are wearing masks and others aren't. Some people are coming close and others aren't. I realized that same thing. And it was interesting when I went into the grocery store just the other day, and now I'm seeing 50%, maybe a little bit more wearing masks or some sort of covering over their mouths, and the others aren't. And I look at them differently, right? I have a different perspective view of them than I did before. And do you think those social norms, I mean, how does that impact, moving forward? Do you see this being, go ahead.
I think it is a very good question because I have the same reaction when I go to the supermarket and see people without a mask. And sometimes I think, well, maybe they couldn't find a mask because there is really a problem with finding masks. But still, you see some people that put, something, a scarf or something on their mouth and nose. So obviously, it's not just the fact that there aren't masks. When you see that, you start thinking these people don't really care. Yeah. Now, what bothers me is the following. It's not the case that COVID-19 will disappear. Poof. Okay. A cloud of smoke is gone. It will stay. It will stay. We are flattening the curve, but it means it will stay a long time. And until there is a vaccine, it will stay. Yeah. And so the problem is we have to prepare people to take measures against COVID-19, and it's not today or tomorrow, maybe months in which people have to take like social distancing, don't shake hands, maybe put a mask if you are in a crowd, etc., etc. So this is the new normal that should be implemented. And the question is how to implement it, how to create this new norm. And again, the descriptive message is very important. Yeah. Very important.
Yeah.
You have to show people that do that.
You have to show them. Yeah, it's interesting. We're in Minneapolis, and so your thing about scarves, I thought too, maybe they just don't have a mask. And I go, everybody up here has a scarf. I mean, if nothing else, it's Minnesota. You can wear something. So.
Exactly. And so you're right. When I see people with a scarf and people without anything, I think they really don't care.
I mean, the scarf isn't as perfect, but I attribute them. They're trying. They have a concern for others, and that's that piece that comes out of that.
Absolutely, but also concern for themselves because you are protecting yourself too. And so the people who don't, I think the message they send is, this is not real. It's not that important. This is the problem.
Right.
This is the problem that for themselves, they think they don't need, to take care because it's not that dangerous.
Well, and we get back to this very fierce sense of independence and individuality. Certainly, Italians are no different when it comes to I'm going to speak my mind. I'm going to do what I want to do.
Super individualistic. Italians are a shining example.
Yeah, but whether we're in Philadelphia or Minneapolis or Milan, that independence is very strong. And if we're going to make a difference, we still have to agree to some degree. We have to agree on the collective well-being, right?
Okay, we're doing a big survey in many different countries, and a lot of European countries, Latin American countries, South Korea, and China. And this is a very interesting, at another time I will give you the results, but this is a very interesting survey, because what we are asking are about people expectations about other people, what they think is right or wrong, what they think other people think is right or wrong. We give them vignettes, this hypothetical person is in a situation where, let's say all people were, many people, not all, it's always most people, let's say, stay home, but also many people think is really not that relevant, is not that important, etc. They stay, but they don't judge. If you don't stay, what do you think this hypothetical character will do, and so on and so forth, because we want to see, in fact, which expectations, which information about behavior, descriptive, normative, etc., especially when they are in conflict, what people follow. And then we ask a question about trust, especially in personal trust. Do you trust your government? And then, the trust question are very similar to what is asked in the World Values Survey. When you look at trusting various organizations, do you trust the police, do you trust the medical system, etc., etc. So we add that. And what I believe, and I think I'm right, but I cannot tell.
We trust you.
That there will be enormous cultural differences. And these cultural differences may explain why certain messages are not really important or are not really effective, more than important, in certain situations, and also teach us which messages would be most adequate in these different cultures. Because I think, going back to your original question about political affiliation, etc., it's a cultural element. If people are super independent and trust only themselves, don't trust maybe the government, okay, which is Italy. Italy, there is very little trust in the central government, especially, much less so probably in the local government, but the central government is not trusted very much. Then, of course, this has repercussions on, the acceptance of certain messages and the kind of messages that should be given. While in China, whether they trust it or not, China is not a democracy, so they can, of course, prevent people from going out with very stark means. But maybe people accept that. This may be the interesting thing. Because in Italy, I give you an example, it's very interesting. In Italy, where my mother is now, we are from Milano, but my mother is living in Forte dei Marmi, which is a very nice place in Tuscany. There is police everywhere in the street. And police are stopping you if you walk, bicycle, are on a car, they stop you. And they ask you, where are you going? What are you doing? So there is a lot of control, which is not happening here, especially in the original red zones where everything started. The army was there. And it was closing. You couldn't go in or out of this little town for your dear life. Nothing get in or out, only, food. Big trucks with food. But the army had to be there. Wow. Okay? So this is the level we were at. Yeah. And we are at because the police is in the streets. They stop you. What are you doing? Where are you going?
Even with that, Italy has had a tremendous problem with infections and deaths.
Yes. Again, going back to messages, the problem is the Italian television shows all these police in the street and says things like, today, thousands of fines, were given to people and people were denounced. And even they say people who should be quarantined because they are positive to the COVID are going out. So obviously, when you give this message, what will people think?
Yeah. Yeah, it's the descriptive again to the part where they're going, all right, if
Negative.
thousands of people are
Yeah,
getting fined, there's thousands of people out there, plus however many people didn't get fined that are still going out.
exactly.
Yeah,
Exactly. That's a
we
problem.
infer. Oh man,
Yeah.
and again, I think it's difficult given, as you said, the media versus government versus social media, all of the different channels that we have today to get information. Again, if I were to look at this, if when I was growing up in the 70s and 80s, you had newspaper and you had the evening news, radio, and that was it, right? Except for talking to your neighbors right across the street. The methods, that the channels to get information or to get conflicting information or ambiguous information across weren't there. So I think today's world lends itself into some of the confusion that's going on and some of the other aspects that are playing out because of the very nature of how we communicate today.
Yes, and also, the ambiguity is basically incredible because, for example, the Italian government sent a message recently saying parents can go out with kids. Okay. And kids, as you know, don't think of social distancing. They run around, etc., etc. And there was immediately a huge protest because they say, "What the hell are you saying? You are putting this kid at risk, etc." And so they retracted that.
Oh.
But so there is this constant, it's true that we are learning as we go. And so we're learning that certain things maybe we can do or we cannot. But again, we should try to avoid messages that may be ambiguous, because going out with kids means, you take them with you, they run around, etc. It may not be a good idea. They should stay home at this point. So again, I go back to the issue, avoid ambiguity. And many of the messages we receive are super ambiguous or contradictory even, You say stay home and then you say go with the kids and the next day you say no, maybe not.
Yeah. If you had a crystal ball and could look out into the future, what do you think are the new habits or the new social norms that might stick?
I have thought of that. This is a very interesting question. One thing I think may change is working from home. Now, typically companies don't like that. Okay. Even high-tech companies, I remember at a certain point, Yahoo prohibited employees from working from home. And the idea, I guess, behind that was, they are not as productive or as efficient as they could be in the office. And actually, probably company now sees that it is the contrary. Actually, people are, because they don't have that many distractions, they don't have the commute, etc., they may be extremely productive and efficient. So I think that this may change a few things, This is one thing. Another thing that, especially in the US, is very important, and this is a big question I have, will people start thinking that we need a less individualistic medical system? I come from Europe where we have national health systems, so I am very accustomed to that. And here the big surprise is, you have to spend a lot of resources to get, good medical insurance. And sometimes, people who think, I have good medical insurance, then they realize that they don't, that the insurance denies a lot of things, etc. So I wonder, somebody without insurance that gets COVID-19 and has to be in intensive care, what happens to them?
And the fact that insurance is tied to employment, and with the, just 10 million plus that have been unemployed in the last 3 weeks, now their insurance is probably likely up for many of those people again. So tying insurance to employment in a case like this, again, seems kind of, now that we go through this, is that really the best model to have?
No, it's not exactly. But I wonder if in the U.S. There will be a sort of waking up to this problem.
Yeah, I wonder too.
Or not. And I cannot tell. I cannot tell. Surely, I think lots of people will be very aware of that because of all the cases and all the hospitalizations. Whether we will see a change, I'm not sure. Another thing is, will we have mandated paid sick leave? Okay, this is another important thing. And I think there should be a change there. And possibly this will be a big item of political discussion. Yeah. And I think probably there will be an important demand from people, from workers to have that. And, there are people who say, should there be like what we have in Italy, a citizenship salary, to give, people who really don't have a jobs, can't find a jobs, etc., because we are getting over 6 million unemployed here as we speak in the US. Yeah. And therefore the question is, should we pay these people, give these people a basic income, a basic livelihood? And I think, so I don't know if the US is politically prepared to have a debate about that. But I think in some quarters, there may be a push to at least look, what can we do for these people? Because, Americans have to understand that the flip side of that is social unrest.
Yeah.
It's not that these people will be happily poor without any health care, any money. They probably will rebel. So social unrest is something that you have to think about. It's very interesting because there is an expectation of social unrest when I saw that in Philadelphia, people were buying a lot of firearms recently. Why do they do that? Exactly because they have a certain expectation about violence increasing. But why violence is increasing? Because, especially in Philadelphia, we have lots of poor people, they don't have livelihood. What happens to them? So I expect at least certain things will change, and I expect at least a discussion, especially among the Democrats, about these alternative ways, basically, to coping with this kind of problems. Because I think that this is not just one event in the life, given that the world is so connected, probably we could have other pandemics. Another thing that I expect would be a sort of retreat from globalization.
Oh.
Because the problem is the supply chain. A lot of things we build in the US, parts of what we build are supplied by China, mostly by China. And the problem is, when there is a disruption in the supply chain, we pay a very huge price. So what I think will happen, at least in certain productions, would be probably bringing back the supply chain, producing it in the US. I think it will happen. It should happen, actually, especially medicine also.
Yeah, I was just going to say, could you imagine that being more impactful or more likely in things that are critical, like medical products, and less a concern for home electronics, for instance?
I think so. Though, I don't know how Apple, for example, who has most of the parts, built in China, what they will do. So maybe they want to differentiate, the supply chain. To do in different countries, etc. I don't know. But certainly for things that are crucial, I would expect coming back to the States. It will be a little bit more costly, is safer, is much safer.
Yeah, and I think you're absolutely right. We talked with Barry Ritholtz, and he mentioned something very similar to that. Like, hey, from a medical perspective, these pieces, why are we outsourcing them to these other countries where we don't have control over that supply chain? And then the other aspect I think that you talked about is, will this is an unprecedented event for us. I mean, it's happened in Asia where there's been, epidemics that have gone on and very different things. But in the United States, and I think probably in most of Europe, at least in our lifetimes, this is unprecedented. But the idea that another pandemic could come around another 5, 10, 15 years, it may be more present now. And we talked again with some other guests about that. But how will that change how our social interactions and social norms happen? Is there anything, any research that you know of about the expectations of potential things that could happen and how those impact how we work together?
I think there has been research about preparedness and, how prepared we should be. Because of course, you cannot predict what will happen, and you cannot have a vaccine for something you don't know is going to happen. But to put more money into research, okay, and certainly putting a lot of money into preparedness, because what I am seeing is that no country was well prepared. And preparedness just means, protection, the famous PPE, the masks, the ventilators, the respirators, etc. were not there. And especially in the US, there are very few ICUs because the ICU costs a lot of money, is extremely expensive. And therefore, hospitals tend not to splurge on ICUs. And in this case, we need a lot of ICUs and should be prepared to that. So I think preparedness would be, a big ticket to think about.
Yeah.
To have more of that.
Just even the hospital beds beyond ICUs. I saw a stat the other day that America has the fewest hospital beds per capita of any of the industrialized countries in the world. And again, it's the model that we have. We have a for-profit hospital system.
Absolutely. And it is a bad system.
Yeah. For in situations like this, exactly. This points that out, that preparedness isn't there, that we don't have that. And we talked with Annie Duke, and she talked about hedging and just the idea of, you have to, to have a couple extra thousand ventilators in storage somewhere costs some money, but it's a hedge against one of these things that,
Exactly. And that's what I think should be done, that all countries should be prepared in this respect. Mm-hmm. And also, there is, I heard an interview on CNN with Bill Gates, and he is giving a lot of money to different companies. One of them is Moderna, which I like a lot. And they work not so much on DNA, but RNA. It's very promising. And again, it's very interesting that it's not so much the government which is supporting this research, but it's mostly private. Yeah. While in Europe is a little bit different, it's more the government that gives money, endows these company research centers, etc. It's very interesting. It's a very different model, but it may work. But I was very impressed by what, Bill Gates is doing.
I want to go back to the possible things that might happen. And I always wondered about or the impact that time has on developing new social norms. And I go back to my parents grew up during the Depression in the United States. They went through World War II. So being very thrifty with every dollar that they did was prevalent throughout their whole life. they died with a very thrifty sense about them. And I think about how many years they had to deal with needing to be conservative. So this crisis might only last a few weeks or a few months. Is it long enough for us to instill new social norms?
I'm not sure about that, because also my parents, went through the war. And there it was terrible because their cities were bombed.
Yeah.
Yeah.
They had to survive, etc. And sometimes, there was no food in the city. I mean, it was a terrible, terrible situation. And so they were always thrifty. So, for example, my father's mantra was never borrow money. So when I did a mortgage for the first time, I thought I cannot sleep at night. And I was amazed by the largesse of Americans.
Yeah.
And I'm still far away from that, actually. I'm not sure about that, because I think people who lived the Great Depression, etc., it lasted quite a while.
Yeah.
Okay, and so it really changed their way of thinking about money, investment, etc. Now, it's interesting. Look at what happened in 2008. We had a big market crash. But look what happened afterwards. The market went up again and people started investing again in the market, even if there was a lot of overvaluation. I still expect people to buy risky assets. Stocks are risky assets. So I still believe that people won't change their habits in this respect. So if you were buying stocks before, maybe you will buy, less of a percentage. If it was 70%, you may go to 60 or 50%. But I still think that people will do that. Also because pensions don't exist anymore. Thrifty with what?
It's gone.
You have to invest for your old age, etc. And the market is certainly has behaved very well. So I don't think that people will change their habits significantly. No.
So Cristina, for our listeners out there, you've talked a lot about some really good, those six ideas about how to better make sure that you're communicating to drive these changes. Mm-hmm. What can a typical person like Tim or me or anybody who's listening do in order to help not just themselves, but the collective welfare that we talked about?
Well, help with example. Okay, as as much as you have some reference network, people, who in your case, people who listen to you. This is very important because you have a public, and so to broadcast good ideas, good behavior, etc. In your case, you have the means of doing that. Okay, people normally have much less of that. So we can talk to our friends. We can, I have Zoom meetings with my friends actually, and we will see each other, staying home, etc. But, I can talk to my students. I can write an article, but I'm much less heard than you are. So in your case, you can do a lot by spreading these kind of messages, I think. With our lives, we can give good example. But in your case, you can do much more. Certainly, another thing we could do is volunteer. I see a lot of really good work done by volunteers. I am amazed by what happened in Italy. Doctors were retired. Went back to work, and now we have reached 100 deaths of doctors. So they are really heroes. They went back to work, volunteered, and died, probably because they didn't have enough protection. So, you don't need to volunteer because we can't. We are no doctor or nurses, but, we can volunteer in different avenues with, paying for food, for example, because there are lots of people, especially here in Philadelphia, who are without food. So there are ways, of course, where we can help other people. But in your case, you can really broadcast, widely good messages. And I think it's important.
We're trying to do that. So, and hopefully our listeners will broaden that and share the information that they can. And again, do those things that are important and make the difference as we move forward with this. So.
Okay.
Cristina, thank you so much for joining us. This is always a pleasure, and this was a wonderful conversation. We really appreciate it.
Thank you for having me.
Welcome to the special edition grooving session where Tim and I groove on some ideas and concepts that were inspired by our conversation with Cristina.
Oh, great conversation, wasn't it? Man,
oh my gosh, she's always
just a mind bender. I love coming away from a conversation with Cristina because I feel like my brain is just full of all kinds of wonderful new ways to frame the world.
She's brilliant. And that's all I can say is she's brilliant. Yeah. And to your point, the way that she talks about these elements brings it back down into really manageable bits that
very much so.
I think a lot of people can take some inspiration from. All right.
So what was the first manageable bit that you came away with?
Oh man, it's so hard to pick one
of the many. How about just start with one?
So behaviors are interdependent. It's what she started off with, right?
Yes.
And talking about this idea that my preference for doing a behavior depends on not only what I see or think other people are actually doing, that descriptive aspect, but it's also what I think others will think about me doing that behavior. So my preference for doing a behavior is impacted by both. So it's a descriptive component and an injunctive component included in there.
Right. I think that's an important part about this is that it is influenced by this, my perception of how actually I see people actually doing things, right? What it is, but then there's also this element, this injunctive element of what I think would sort of be approved.
What I should be doing, and what other people what they approve of or don't approve
of in the group, and that those two things really need to work together in these big picture situations, right?
Right. And I loved. So later on, she talked about. And I'll try to quote here is like, all my research shows that the descriptive message is a stronger signal than prescriptive, i.e. or injunctive. Yeah. So the idea that while both are really important in these times and in other times in general, that descriptive, what people are actually doing or what we infer, what we believe people are actually doing is the more powerful of those.
Which is the experience that we have when we go to the grocery store and we see that almost all, if not all of the toilet paper is off the shelf. We think, oh my gosh, if everyone else is buying it, maybe I should too, because this is how people are behaving.
Right. As opposed to the injunctive going, you shouldn't buy that toilet paper because you don't need it. You have 12 rolls back at home. It will last you another 2 weeks, 3 weeks.
Yeah, 12 packs. Right.
The other part that I thought was really interesting about this conversation, and it goes back to the conversation we had with her back in episode 102, is this idea of reference networks and how vital that reference network is to changing behavior. That we look to others who we feel are like us. And that's really important.
But they are easily diluted.
Yeah.
Yeah, right.
That was a great point. The idea that it doesn't take much for us to say that, oh, those people aren't like us.
That's not me. I don't relate to that. Yeah. They're different from me. And I think this is something where marketers need to take advantage of this, of course, whenever they're selling products. But right now, during the crisis, it's extremely important for leaders to be able to parse out the right messengers, to get the right reference networks going so that we can get the right messages to the right people in the right way.
Right. And again, talking about the messenger effect that we had, right? The who is sending that message, making sure that that messenger is appropriate for that reference network.
Yeah.
The piece that is difficult in this, and I think this is another big theme of this whole thing, is that these messaging aspects are really difficult. They're not easy. But I think one of the hard pieces of this is because that reference network is easily diluted, you oftentimes have to get down to a really small subset. And as from a policy perspective, from a governmental or large organization trying to change that behavior, you might be able to do that with some of the machine learning and AI that's going on, but that's more difficult. So
It's hard. Yeah.
it's hard. So how do you expand that the appropriate reference network for people and make that meaningful and yet not so small that it becomes a nightmare of actually application and implementation of those? I think that's really interesting.
Yeah. Well, and while we're on that, this whole idea that messaging is hard, I thought it was very generous of Cristina to point out that leaders probably don't want to be stupid. They don't want to act badly. They don't want to mislead people. They really don't. But it is very hard, and I think it's fair that we hold leaders accountable for being better than just sort of whatever. You've got to actually be more intentional. Leaders need to set good examples at the same time they are messaging in appropriate ways.
Right. And even while their intentions may be right, when they do mess up, it's one of the things that happens is because we are motivated thinkers, because we tend to have confirmation bias around our a priori beliefs, that we twist reality, as she said, and we choose what to believe. So by actually being, have the best intentions, but by messing up, we enable, or our leaders enable, that motivated thinking much more so than would happen if it wasn't that case. So again, it's hard. It is really, really hard. And I give our leaders, even the ones that I disagree with, a level of forgiveness around this to a certain degree. But I think we could do a lot better.
Agreed. Let's also make sure that we talk a little bit about the 6 rules that Cristina brought up, because they were terrific. And it's so great, again, that she reached out and said, hey, I've got these ideas. Let's talk about them. And of course, who's going to say no to Cristina Bicchieri?
That was your email to me. It said, who are we to say no? And I agree. Nobody, I'm not going to say no.
Of the 6 rules, which do you think was really, which stood out to you, Kurt?
Well, let's go. I'll review them really quick. All right. So 1, do not send conflicting information. 2, let's make the desired behavior observable. 3, give information of what others are doing when positive. So having that descriptive norm when those behaviors are positive. Yep. 4, choose the appropriate reference network. 5, avoid moralizing messages. Mm-hmm. And 6, avoid ambiguity. They're all, I think, really powerful. For me, the idea of avoiding moralizing messages is one that I think is really difficult for people to do, and gets into this part of, are you moralizing if you're telling people facts about what should happen? In other words, are you moralizing when you get into this idea of you're sending out the message of you should stay 6 feet apart? That's a specific fact of social physical distancing. But it sounds like moralizing because you put the should in front of it.
Right.
And I think that's a really tricky one for leaders, experts in this crisis to do, because you have to get the information out. But how do you do that in a way that doesn't backfire?
That is a big challenge. For me, the big rule that stuck out was, let's make the desired behavior observable. And this is where I think the media is really kind of muffing things, because they're not interested in reporting on things that don't happen.
Right.
It's not interesting to show an empty street and say, "Oh, look, no one's going out."
Yeah, it's that desired behavior is people staying indoors, washing their hands, staying 6 feet apart. Doesn't really come to the level of newsworthiness for most people.
No, I think that some of the best video images that I've seen have been of the high-rise apartments of people coming out and singing songs or clapping or applauding the first response workers coming into their shift or singing songs in the streets or not in the streets but from their balconies. Like those are the things that I think really are both newsworthy and reinforce the idea that we're not leaving our balcony. We're not leaving our apartment. We're staying inside.
Right.
And that's newsworthy. And I get that it's hard for the media to show a picture of Bourbon Street in the French Quarter in New Orleans, almost completely empty. But I would rather see this is Bourbon Street in New Orleans completely empty, not with a soul on it, than to see 5 or 6 people walking around. That somehow legitimizes bad behavior when I view it.
Again, it's the inference of those descriptive norms. So, all right, correct messaging is hard. Context is vital. Variables are tricky. We infer meaning from things that isn't always apparent. Again, I loved her message about how the Italian media showing people were being fined. Thousands of people were being fined in Italy for being outside. Seems innocuous enough. Yet the implied message from that, which Cristina pointed out, is that lots and lots of people are outside, that maybe that norm of staying inside isn't really what people are doing, and that they're really outside, which was different than that injunctive message that the leaders were saying to stay home, to stay inside.
It sounds like a moral dilemma where we would ask the media to not report on something in order to get sort of the right behavior, right? So does the end justify the means? If not reporting the facts, but relying on the absence of those facts that 1,000 people were arrested to actually give people the impression that no one's going out.
I know. And then it gets into, then you run the risk of having this partisanship coming in, at least in America, where even news organizations are now identified as partisan. So then you can run the risk that you are labeled as trying to hide facts in different pieces, which then again lends itself into that referential network.
Yeah. Within
one group or another, the descriptive aspects of, well, yeah, they're hiding things. They're not. So it isn't. So it even becomes more of this descriptive norm that we believe because it actually plays into our pre-held motivated reasoning beliefs.
Confirmation bias at work.
Yeah.
Absolutely.
So what if, and this is just a hypothetical thought experiment here, what if instead of the media not reporting it, they framed it in a way that was different? So it's important to understand that there are thousands of people being fined out in Italy. But what if they framed it such that, hey, here's some news. We have 1,000 people that were fined today in Italy for walking out. Those idiots are just really stupid in this. But compared to the millions of people, the multiple millions of people who are staying home, who are doing the good thing, the right thing, those are the people that we want to applaud.
And then link that to video that is the clean streets. Right. So that we've got this visual support. That's a really interesting idea, Kurt. That's really
or putting that up, the images again, those positive images of people from their balcony staying physically distant and doing some of the good things. Maybe the way that media frames this in a crisis situation could be adjusted in order to allow for the facts to be out there, but with a way of stating that helps drive the right behaviors that are going to save lives.
Mm-hmm. Yeah,
just
absolutely.
A thought experiment.
Okay. What else?
She talked a lot about some of the changes that could be a result of this. And of course, I have to talk about.
Yeah. Yeah, UBI.
Universal Basic Income.
You're going there, which is important because it absolutely raises the question about healthcare, not a single payer system, but actually a nationalized healthcare system. And of course, what happens to all these gig workers, these people who don't have big companies subsidizing their healthcare?
Yeah, the healthcare component of this is really interesting. The global supply chain that she talked about and changes to that. Are we outsourcing critical components in a time of crisis? How does that work? So I think there's a lot that we will probably be thinking of and hopefully contemplating as a result of this from a societal perspective. Mm-hmm. And it's interesting. Cristina is a social scientist. She works in the large society aspect of this, and her focus was on those societal changes that will be coming as a result of this, often policy driven. Where others, when we've asked that question, have been more on the individual habits that we might change and maybe even to an organizational perspective. So I thought that was really an interesting dynamic of this as well. Going back to UBI, though, think about the difference that this would be. We just found out as the recording of this that new unemployment numbers came in. So 17 million people in the United States are unemployed right now. Yeah. Having a UBI would mean that those 17 million wouldn't be without a paycheck. And granted, they're getting unemployment right now, but that will last for only so much. And for others, it may not happen at all, depending upon various different aspects of that. So you wouldn't have the angst and the worry, and that people wouldn't be not paying their rent. They saw another statistic today where it was 69% of people paid rent in April as of April 1st versus 81% the month before. There's always a certain percentage that don't, but that's a big 12% decrease month over month. Right. And it's only probably going to get worse.
With UBI, those people would be going out and they would still continue to spend not just on groceries, but they could also spend on buying new clothes or new sheets, or spend on the project that they wanted to get done at home, some construction items, some paint, some nails, some hammers, all those kinds of things, as well as paying their rent and making their basic obligations on that they have, would all happen pretty seamlessly with a UBI.
Yeah, and it's not a cure-all. It's not a silver bullet, but it can help, and particularly in situations such as this. Thank you for listening to the special episode of Behavior Grooves. We hope that you found it interesting and insightful. If you liked it, please let others know. We think that the topic is important, and maybe we can help in educating people about how behavioral science can help us all out in this current craziness that we are going through.
Also, please let us know if you have any thoughts or ideas that would be helpful or that we could share. You can reach us through the Connect tab on the Behavior Grooves website at www.behavioralgrooves.com, or through Twitter. I'm at @THoulahan and Kurt is at @WhatMotivates. We really do love hearing from you, and this topic is one that spurs lots of emotions and thought.
As part of our mission, we want to expand and inform the community of people who think about positively applying behavioral science to life. One way that happens is through leaving reviews. If you think this podcast is beneficial and should grow, we would really appreciate to leave a review on Apple Podcasts or whichever podcast server you use.
It only takes a few minutes and goes a long way to boost us in the algorithms that are used to generate search results.
Also, please check out the show notes. We are linking to a number of resources, articles, podcasts, newsletters that we've vetted to bring good facts and ideas around COVID-19 and the coronavirus, its impact, and ways that we can help slow down the spread. There is a lot of information that's being pushed out to everyone each day, and we are weeding through it to find good stuff so that you don't have to.
We truly appreciate you listening. Now go out and wash your hands.